Hi, I'm Dr. Dhairyasheel Savant. I'm a senior consultant cancer surgeon at the Asian Cancer Institute in Mumbai. Okay, so there are two reasons. One, mainly two reasons, is that uh, we have in males the common cancers being the head and neck and the lung cancers, which are tobacco related cancers, and in females we have the breast and cervix cancer. And main reason being that there is a lifestyle change. In males, tobacco consumption is coming in at an earlier date because of peer pressure, because of being readily available in schools and colleges, whether it be in smoked tobacco or smokeless tobacco. And in females, again, it's the lifestyle change which was not there previously, has now come upon in even in our society, and hence the incidence of both in males and females, we are seeing more and more younger patients coming in for diagnosis as well as treatment. So one of our focuses in our institute, the Asian Cancer Institute, is to do a lot of preventive oncology, which is a definite branch of oncology that we see, and we feel that awareness has really changed the picture in cancer in most cancers. For example, in head and neck cancers, there was a time when we were seeing most three-fourths of the cancers in stage 3 and stage 4. Today, that figure is changing. We are seeing stage 2, stage 3 more, so which means that we can treat those cancers. And being so that this is occurring in a younger age group, the socio-economic implications of these patients is huge. We are a loss to society, and hence at the Asian Cancer Institute we feel that trying to give the same quality of care, the same values at an affordable cost, but in a shorter period of time, really would enhance the results in a longer duration. Obviously you are looking at the working population, and this is the age when all of us are growing in our incomes, in our lifestyles, in everything. And at that time, if we really affect cancer afflicts that person, obviously he's going to be a drain on himself, on his family, and there are very very far reaching implications for this, as opposed to somebody which is at an older age. And this is what has actually happened in our country. There was a time when there were young cancer patients were maybe 20% of the total overall load. Today we are seeing them at nearly 40% of the overall load, which is really a drain. Okay, as I said, preventive oncology is one of our focuses. We regularly hold camps at our institute and in the outreach in Mumbai and outside. Like we held a camp in Bhubaneswar recently, where we basically examine patients for head and neck cancer, for breast cancer, for cervical cancer. And the best part is that all these tests are not costly. They are usually labor intensive. That means we as doctors have to go there and do those tests. And doing this simple test, we can really catch these cancers at an earlier stage. And catching them at an earlier stage or in precancerous areas, we can definitely avoid either cancers or treat them at an earlier stage. So that is one part that we are looking at. And of course, if we do get patients which are treatable, we offer them surgery, which is one of the branches that we have, or radiation oncology or chemotherapy. Whatever is the current state of art that we are that's available in the West, we try and inculcate and transfer that same technology on to our patients as much as possible. There are obviously restrictions because of economic restrictions to some of our patients, but by far and large, I think we can use the same technology. So a patient being treated at our institute would probably get the best care and the same care what you would get in any center abroad or in the country.
And what are the other challenges that you find here?
The challenge is obviously is the cost, and we try to mitigate the cost by giving the treatment at an affordable value, and for us to impart training. So at our hospital we regularly hold workshops as well as continuing medical educational programs, where we ask all the people to come in and we impart this training. We have had about 5 or 6 workshops till date, which were very popular. And since we have a lot of cream of the surgical areas, so we can really do the training. So that second generation or the third generation of people who need to get exposed, not only in the surgical field, but suppose there is a general practitioner, and if we expose them to what we can treat and what is achievable, probably we start getting patients earlier. So now it's not only the patients which need to be educated, even the doctors need to be educated on what is current and what is doable. So that's the third part or the fourth part of treatment. We have a dedicated palliative care center. In our hospital, we have home care palliative physicians which are attached to our hospital. So any patient who does require palliative care, either pain management or palliative care. So the pain management, we have an excellent department in our hospital which takes care of that. And as far as patients who cannot afford to come here, or it's not possible physically, logistically to come to our institute, we have our care physicians to go there, whether it be pain medicines, whether it be speech, rehab, ostomy care. All those departments would go on a home visit and see that the patient is taken care of. Oh, the future is bright. I don't think there is anything. We are slowly, the number of people being trained in cancer is increasing, the number of centers offering are increasing, and I think India, with its newfound strengths, will definitely go a long way. We need now to address these problems individually, and if we focus on those issues, I'm sure we will be able to achieve it. I don't think there's a problem.